Hi everyone, welcome back to iMumz Ask Me Anything session. My name is Anusya. Many of you know me probably. Today we have another very special guest with us, Dr. Kinjawadekar. He is been practicing for 29 years now, so he knows all in and out of all the issues that babies face, and we understand that COVID has become such an important topic for you new mothers because suddenly most of the family members are positive, some of us are testing positive, so you have so many questions. Some of our babies are positive, so sir is going to speak to you on all about COVID-19 and how you can tackle the situation best. And sir has also launched fitness program for school going kids called Fit Hai to Hit Hai. And then he has a book for many of the Marathi moms. Probably it can help you a lot. Dr. Ek Vicharu is a Marathi winner of the best medical book for parents. So probably one of the must-have books in your library. Doctor, all over to you. You can speak to them and let them know all you can about COVID-19.
Okay, thank you very much. A very good evening, Anushya. And at the outset, let me thank you for your kind invitation. At the same time, last minute changing the topic. Yesterday we were supposed to speak something else, but then I can understand the importance of COVID has made COVID take center stage in today's discussion rather than anything else, and it's quite natural. But before going ahead, let me wish a very, very happy New Year in the form of Gudi Padwa for all our Maharashtrian viewers, and as well as happy Ugadi for those who are from Karnataka, Andhra Pradesh, Telangana. So this is an auspicious day in the calendar, and let us all hope that this new year brings us health, happiness all over again, and we have a wonderful time in 2021, what a balance 8 months, and we all become healthy. That is what is important. So talking about COVID, I don't mind answering questions, anything that the parents have it. But as very rightly said by Anushya, that it's really become a big issue, not only in Maharashtra in particular, but it's becoming pan-India issue now. But Maharashtra is a center stage. In fact, entire world is right now focusing on Maharashtra, and that's quite natural because the cases. And just now I read it's about yesterday was 1,60,000 or something like one single day cases. That's huge in our country, so the burden is really huge, and then there is no shortcut. So there are two or three simple messages that I would like to give. First and foremost, every household, whoever is watching today, the number of people who are above 45 years of age in your house, they must be vaccinated under any circumstances. So that's my first message. So may it be your mom, daddy, your uncle, auntie, your friends, just call them whenever you're chatting on WhatsApp. Ensure that everybody above 45 years of age in this country has taken a vaccine. Because mind you, even if you get COVID after vaccine, which is very much possible, still the chances of it becoming very serious, you developing complications, landing into ICU are very, 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 very less if you are protected with a vaccine. So that's a very important message. And the second important point is that even if you have one dose and you safely pass through about 2 weeks period, still you are good, well protected. So 2 doses is excellent, but even if you have one dose, that's fine. As of now in India, all of us know there are two types of vaccines which are available, Covishield and Covaxin. Don't get into the details of which is better, just whatever is available nearest to your place of residence, go there and have it. It is restarted. There were a couple of days yesterday, day before yesterday, there was some shortage, but now all the problems have been sorted and now the vaccine is freely available. So please go ahead and have your vaccine. So that's second important issue. And at the same time, even if you take a vaccine, that does not mean that you have to lower your guard. So you have to be extremely vigilant in protecting yourself as well as people around you by wearing a mask. Do gas duri, mask hai zaruri. That slogan still holds true even if you are vaccinated. So that's very important because otherwise what happens? After you take vaccine, you are into a false sense of security. I told you, the chances of you developing complications would be minimized to a great extent by vaccine, but does not mean that you will not be infected. And if you are infected, there are chances that you may spread it to others. So I think these are the important points that I would like to start off with, and I'm ready to answer any of your questions.
Okay. Sir, Sony Kaushik, she's saying my 3-month-old baby is positive. It's been 15 days. She is still having loose motions. My pediatrician told me to stop breastfeeding, start Similac comfort milk. But my baby is not taking Similac and crying like anything. She doesn't sleep at night. She cried a lot. So, what would you suggest?
What I understand is you have a 3-month-old baby who is positive, but I'm not
Yes.
sure whether you are positive or not. I would like to ask this mom. And how many other members of the family are positive? That's very important to understand, because it's extremely unlikely that only a 3-month-old baby getting infected, leaving aside all the family members who are negative. From where will this baby get infected? So either the baby has traveled to somebody else's house, grandparents' house, or uncle's house, and their baby has got infected. But in all probabilities, the mother has to be checked, and it is possible that mother will be infected. Now, it doesn't make any
Yes,
difference.
she
Even
is positive.
ah, so very important that you and your baby should stay together. You should not separate yourself from your baby. And I'm very sorry to say the advice given to you for stopping breastfeeding is extremely wrong. In fact, I'm disturbed with the.
She has just messaged saying all 5 members in the family are positive.
That's why I wish you all speedy recovery. No problem. Don't worry about it. But the point is, do not stop breastfeeding, even if you are infected. First 6 months, 180 days of life, it is that baby's birthright to have a drop of every drop of breast milk that the mother is producing, and baby has to consume that. In fact, in first 6 months of life, we say that nothing else but breast milk is what the baby requires. So please, please, please don't follow this advice. In fact, share the number of this pediatrician who has told you this advice. Please request, in fact, call him back after this program. Tell my name, Dr. Upendra was saying no stopping breast milk, no giving top milk to a 3-month-old baby for this reason, and let's continue with breast milk. That's very important. And then you said the consequences you've seen yourself. Baby keeps crying, baby is not happy, you are not happy. You may get breast engorgement, abscess, anything, some complications may develop. Now, for what reason? COVID doesn't transmit through breast milk. The studies have proved that. And then at the same time, you want to protect your baby. So when you're feeding, you're taking the baby close, wear the mask. And the moment you have finished feeding and burping the baby, keep the baby away from 6 feet away from you. So that as long as possible, as much as possible, it is not through breast milk, but you coughing, you kissing, you coming close contact of the face of the baby from where the droplets can go inside. So that care one has to take care. And all other members are positive. So another message is you did not lock yourself in one single room. Now you and your baby. If entire family is positive, open the doors. All of you can mix together. No problem. Let the outside members be kept away, but you all can mingle together, eat together. No problem.
Thank you, sir. I think that answers Natasha's question. Natasha has messaged, do newborns of 4 5 months old get COVID? So, so one more query here. Sony's daughter, it's been 15 days, right? She's positive and baby is still suffering. So, how long would you think would the recovery take? Because we've heard that babies recover faster than adults.
Right. So it's a very important question. The mother is positive and the baby is also positive. So it will usually take about 10 days time for the mother or any person who is infected with COVID to become non-infectious. So it is first 10 days of illness. So day one, suppose you start fever today, 13th of April, it is up to 23rd of April that you are likely to transmit COVID to others. after 23rd of April, that is after 10th day of illness, or if you have been afebrile, you have not taken a single paracetamol tablet to suppress your fever, it is extremely unlikely that you will transmit COVID to others. So, in all practical probabilities, take care of first 10 days of your illness so that you don't transmit COVID to others, and otherwise it's fine. So after 10th, 11th day, you are likely, even if you are symptomatic, unfortunately, you may complicate. I mean, anybody can do that. It can happen, go downhill. But still, that person will not transmit COVID to others. So 10 days is the golden rule that one can transmit COVID to others.
Thank you, sir. So, how about the baby having loose motion 6 to 7 times a day? Should she be taking some medication or uh,
Okay, so the babies who are this is, I think, nothing related to COVID, but mind you, right now this second wave of COVID which is coming, which has in fact come in already, the important clinical differentiating feature which has come, which was not there in earlier COVID for one first phase, was loose motions were absent in first phase. But now we are seeing many patients who come with diarrhea or loose motions. They last only for a day or two. Later on, the child becomes all right. Even the adults are having loose motions. So that's very much possible. It could be a feature of COVID. That's one. But second very important thing is, even if the baby has loose motions, that does not mean that one has to stop feeding the baby. Very important. So you can continue to feed the baby even if the baby has loose motions. But ensure that the baby passes good amount of urine. There are two things that happen when the small baby who is 4 to 5 months passes motions. Two things which I am worried about is one, dehydration. What do I mean by dehydration? When the salt and water from the body goes down, it becomes less from the intravascular compartment of the body. So less amount of urine is produced, kidneys are in danger, and all the organs start, getting compromised because there is no blood supply happening. So the baby should continue to pass good amount of urine. That means the baby is well hydrated. That is one. And the second danger that I'm worried about once the baby starts loose motion is malnutrition, because these babies do not have sufficient intake and the output is so much. So that's why there is an imbalance between input and output. So there is a likelihood of this baby becoming victim of malnutrition. So to protect these babies, first 6 months, continue breastfeeding as much as you want, and the baby is more than 6 months, of course, one has to give semi-solid to solid foods so that the baby's nutrition is not hampered, and which should be complete. It should be a balanced diet. So first 6 months, breastfeeding takes care of everything. After 6 months, apart from breastfeeding, which is should be continued, maybe up to 2 years of age, but a diet which is full of cereals, fats, carbohydrates, proteins, vitamins, minerals, all are required in proper proportion so that this baby doesn't become malnourished.
thank you, sir. Uh, Amira is saying, I'm going to travel by train with my 3 month old. What precautions should be taken to protect my baby during the travel? Since we cannot use mask for the baby, I think one more query is, how can I prevent my baby getting affected at a gathering?
Avoid gathering is the simplest solution right now. Next 15 days, completely avoid gatherings. Let us all avoid it. Be very serious. It is very easy to criticize state or central government, but the kind of population our country has, the kind of Kumbh Melas which are happening. How can COVID stop? It's not a religious virus that you will say, no, no, these are all people coming together for God, so let me not infect them. So please, let's leave aside religion, but let me tell you, avoid gatherings for next 15 days. Let's take a call after 15 days. So no weddings, no birthdays, no marriage anniversaries, no celebrations, not even going for the funeral. That's one. Second, if it is a must to attend that function, one should see to it that there are less number of people in a AC and a close surrounding. The chances of you taking out mask and then the spread of infection is very fast. In an open, if you are in a garden or if you're in an open air situation, less number of people, the chances of transmission of COVID are extremely less. So the distance also matters and the surroundings also matter. We do not recommend a baby to wear a mask. It is not at all required. In fact, WHO, CDC, even Government of India have not given any guidelines for compulsion to wear mask for babies or children less than 6 years of age. After 6 years, it has been found even children themselves are compliant. They know about COVID. They know about how COVID is transmitted. And then they insist. In fact, they would say, Mama, mujhe ek mask do. Then don't disrespect. Nahi, nahi, tumko zarurat nahi. Even if a 4 year old is good enough, matured enough, and wants to wear and take care of his mask, fine, let him wear. But it's not a must for them to have a mask. That is what is important.
Thank you, sir. So, Sudha is saying our pediatrician said lactating mothers should not be vaccinated. Is it so? Or can they get vaccination and still breastfeed the baby?
Yeah, there is a slight issue about this lactation part of it. Now, the studies which have been done initially did not have any support that the mother can continue. In fact, lactating mothers or in fact pregnant mothers can take the vaccine. So it was a strict no. But now, over last 1 or 2 months, there have been slowly some publications getting out which show that probably after the 16th week of pregnancy, that is first trimester is over and 4 more weeks, the timing of one may take, you have to outweigh the benefits and the risk ratio has to be always calculated. So there is a possibility that one may take vaccine, but still the guidelines are not very clear and openly we do not recommend vaccine to be given during pregnancy. And same thing is with lactation. Initially it was thought and we strictly said no. In fact, many of our healthcare workers, doctors, nurses, they were pregnant and then they had delivered babies and they were feeding, and then still we said that no vaccine for them. But now slowly we feel probably it is safe to take this vaccine during lactation period. But mind you, the final recommendation from ICMR or guiding authorities in regard to this is not yet out. So be careful, but at least in first 6 months when your babies are exclusively breastfed, you can avoid. Maybe after 6 months, and there are great chances of you getting exposed to COVID infection, one can go ahead and take the vaccine.
Thank you, sir. So next question here is Pooja says, me and my baby may have come in contact with a COVID positive person. I don't have any symptoms, but my baby is having dry cough since 1 week. Otherwise, he is active, P count is good. He does 43 to 4 times a day. He's 5.5 months old and on breast milk and formula milk. Should I consult the pediatrician?
Yeah, so there is a possibility that something called as asymptomatic person. That means virus has already entered your body, but still your body doesn't show. Your immunity is so good that you are not having symptoms. So the virus will be killed in your body without you suffering from the disease. You will not even be aware that you were infected with COVID. And only when you do a blood test of antibodies, maybe after 8 to 12 weeks of this episode, you will realize that you have good antibodies. Then you may say, yeah, probably that 13th April time when I had come in contact with COVID positive patient, I was already infected. So there's a one possibility. Secondly, you saying that you are all right and your baby has some symptoms. This is also very much possible. The other way is also possible that you are having symptoms, baby all right, and a baby having symptoms, you all right. Now the trick over here is, the problem in fact is that babies become all right in 1 or 2 days. So by the time you decide whether I should go to a pediatrician or should I get my baby tested, baby's all right. And then you feel, why should I test? Now the baby's all right, I'm all right, let it be over. But the problem in this situation is this 5-month-old baby will be picked up by grandparent in the house. This baby already has infection and it will be spread to the grandparents. So we want to protect grandparents. Now 5-month-old baby you have, so you are a young mother, I can understand. And you won't have any problem even if God forbid you suffer from COVID. But consider your in-laws, your parents. seniors in the house, we are going to protect them. So that's why right now in country, we are vaccinating everybody who is more than 45 years of age. That's precisely the reason behind this. So you have this 5-month-old baby, even if the baby is not suffering or baby has some little cough and you don't test it, then this baby has likelihood of transmitting to elders. So it is a good idea if your baby is 1 or 2 days symptomatic, you have already, you're sure it could be your husband, your brother, where you have come in contact, and you know that for some time the mask was down and both of you talked or something has happened, so that me and my baby have been exposed to COVID virus. It is a good idea to get yourself or your baby, whoever is symptomatic, tested. Now your baby is symptomatic, so you're going to test. If the baby comes positive, you test yourself also. Otherwise, baby is going to transmit it to you. That first contact did not happen, but this baby can get. So that's why babies are termed as super spreaders. And that's precisely the reason why schools are still closed, because it is possible that the babies will go and spread it to, children will go and spread it to others in this class and the teachers and everybody else. So it is good idea that you go yourself, test your baby. If required, you also get yourself tested. But both of you can stay together. You can continue to feed, nothing else. So rest of the things remain same. Testing and protecting for other elders in the family is what is important.
Thank you so much, sir. Sir, Chanchal had a C-section on 6th of April, and on 7th her RT-PCR was positive. She had no symptoms at all, and yesterday she got the rapid test done, and it was negative. So then she started feeding her child because the pediatricians in her hospital and gynecologists were not letting her feed because the baby because she was positive, so they kept baby aside. So now her question is, should I get RT-PCR done again as I'm having, or is rapid test enough? Because the doctor kept me and my baby away, and I have taken baby yesterday. So now he's it is, baby is finding it very hard to drink mother's milk now. So what do I do? I'm still wearing mask while feeding my baby, and all my family members are wearing mask when they come close to the baby. My husband and mother-in-law both were negative.
It's a very long question, but at the same time, the answer is pretty easy and simple. That please remember that you have to, whenever you come in contact with, wherever you, anybody else, one has to wear mask. So there is no shortcut to that. And important to understand that even if your baby was positive, and if you have, both of you have stayed together, there is a chance that you also get infection from baby, or the common contact could be, it's possible. But what was her question? What she wanted to know?
She wants to know if she has to do the RT-PCR again.
Oh yeah, the question about RT-PCR. Now RT-PCR first was positive, and then you again did a rapid antigen test which came negative. I don't believe in that rapid antigen test. Its sensitivity is much less as compared to RT-PCR. RT-PCR is about 60 to 70% positive, and antigen is about 30% less than RT-PCR also. So don't rely on that. Your RT-PCR was positive, was good enough. So you have to take care for 10 days. That's what is important. But your pediatrician and the obstetrician told you to continue to breastfeed. That was a good advice given to you, and you must continue to breastfeed your baby. Don't be away from baby, and don't repeat your RT-PCR. After 10th day, we consider you to be a non-infectious person, and then you can very well, once you are symptom free also, as you said, you have no symptoms also. Even if the cesarean section was done, then it was just because of the section. There are hospital norms and policies which say that one has to do a test. So that's why this test was done. I can understand for that. But it's not a must that you should repeat the test, prove yourself negative, and then continue to feed the baby. These things are not required. Even if your RT-PCR was positive, you continue to breastfeed. Nobody is asked to separate the baby from mother, even if the mother is RT-PCR positive. Please remember that.
Thank you, sir. Sir, Anushri is asking how are babies checked for COVID-19? What are the tests that are done?
Okay, so the test remains same as what we do it in general population. So there are two type of tests. So COVID is all of the reverse transcript test, PCR test. What is PCR? Is polymerase chain reaction. Each one of us, like we have unique thumbprint. So similarly, all of us have a typical unique genetic constitution which is different from others, and that is a signature DNA pattern which is picked up by this PCR. It is amplified, and we know. So this COVID, SARS-CoV-19, the virus which is there, it has its own typical signature pattern which is picked up. It is picked up from two places, either a nasopharyngeal or a oropharyngeal swab by two tests, antigen test as well as a RT-PCR test. Antigen test, the advantage is the repeats results are available in 10 to 15 minutes. RT-PCR, sorry to say, initially it was by the end of the day we used to get, then it went to 24 hours. But this second wave, which is now struck everywhere in Maharashtra, I am finding that people are getting report after 2 days. So 48 hours it takes for the report. But please, if you have suspected or you're suspecting to have COVID and you've sent a swab, till you get the swab report as negative, isolate yourself from others in the family as if you were positive. After 48 hours, report comes negative or something else, dengue comes or malaria comes, that's a different story. You be happy. But then, till the report comes and you have report in hand, consider yourself to be positive and separate yourself from others.
Thank you, sir. Sir, Akansha is asking, what are the other symptoms if baby has COVID other than cough and fever?
Okay, so there are many symptoms. Now, baby can have fever, which is non-specific. I said you can get fever for a day or two, cough, which is usually dry. There could be runny nose. Now, the second wave, what we are finding it is loose motions. I already told you about that. And third, there are certain other complications which can come up later. Still, one has to suspect COVID. What happens is there is a COVID infection and there is a gap of about 1 or 2 months. Nothing happens. COVID becomes all right. After 1 or 2 months, some older children, especially those who are adolescents, they can come out with something like a Kawasaki-like type of fever. That means the eyes become red, you have rash on the body, skin starts getting pilled, your conjunctiva becomes very red. Sometimes you get severe abdominal pain, then your liver becomes big, then polycirrhosis, that means there is a fluid collection, there could be acute kidney injury, so there could be suddenly shock, your palpitations or heart rate may go up. So all system, respiratory distress, that means you find difficulty in breathing. So all these different symptoms, and apart from that, the myalgia, severe leg pain. So these are all the features which are sometimes in the early stage, but most often in the second phase. That is what I say is after 2 months, after development of antibodies. So person doesn't even know. So this person, if I ask him, you had COVID, he said no, because the RT-PCR was never done. But when I check the antibody, I know that probably this person had 2 months ago. Then if you ask him, 2 महीने पहले 1-2 दिन के लिए बुखार था क्या? हाँ डॉक्टर साहब वैसे तो 2 दिन था बुखार. So that gives you a Kawasaki type of, or what is called as multisystem inflammatory syndrome, MISC, in children. So, or PIMS it is called. So this pediatric inflammatory multisystem syndrome, these complications come 2 months after COVID, and they are known in adolescent. That means after 8 to 9-year-old children. Sometimes children come with so much acute abdominal pain that patient is taken up for appendicitis and it was actually COVID. And one should be really very careful before doing any surgery in COVID times. And that's why a report is a must, because the chances of complications, so increased morbidity, are much more if you are also suffering from COVID. So that's why these are all the different varied presentation, protein manifestations of COVID in pediatric age group that one should remember.
Thank you, sir. So, Natasha has another question. We've come to know that 60 plus people are affected more and they are getting more serious, landing in ventilators and all that. So she's saying, do positive newborns also get as serious as adults do? I think you already answered this, but probably she would have missed it.
Yeah, so the answer is no. So fortunately, the babies do not transmit so much. Otherwise, all the healthcare personnel would have also been endangered. But fortunately, that does not happen. But we do take care that when the baby, we say that the mother was positive RT-PCR, So there is a possibility that baby could be positive. We are not going to treat these babies. Fortunately, most of the pediatric patients do not require any treatment and they become all right. Newborn babies, so almost always it's a dictum that they become all right. So we don't give any treatment. We just observe them that if there is any time respiratory distress, something like pneumonia, the heart respiratory rate goes up, they find it difficulty while breathing, then may do X-ray. We might also do CT scan, and we might do tests so that we know that this baby has complicated COVID, and then this patient requires treatment. But by and large, almost take it as a rule that newborn babies are a safe bet for transmitting COVID to others.
Thank you, sir. Sir, I think you have almost partly answered next question. Ankita is asking, if baby gets COVID, then what medications do we need to start?
Okay. So there is no medication for COVID, remember that, for pediatric age group. Like we have, there are only a couple of antiviral medications that we give to adults. Everyone has heard of favipiravir, maybe, or remdesivir. These are two antivirals, please remember them. Adults may require it, but there are no studies and we do not recommend these medicines. Now, most of the people are giving multivitamin, some zinc, some vitamin C. It's all right. This is we call as placebo. लेके थोड़ा अच्छा लगता है कि भाई कोई दवा तो चालू है, इसके लिए वो दवा दी जाती है, बट दे अफेक्टिंग कोविड ऐसा कुछ होता नहीं है. सो डोंट फॉल प्रे टू ऑल दिस इम्यूनिटी बूस्टर्स. और जो एक सालों में भर भर के एडवर्टाइजमेंट और लोगों ने जो कमाया है कि जस्ट इम्यूनिटी बूस्टर, दिस गिव्स यू इम्यूनिटी बूस्टिंग, ऐसा कुछ होता नहीं है. इट इज द मास विच इज द बेस्ट इम्यूनिटी बूस्टर विच इज गोइंग टू प्रोटेक्ट यू. इनफैक्ट सरफेस क्लीनिंग भी, बात थोड़ी मैं ट्रीटमेंट से प्रिवेंशन की तरफ वापस जा रहा हूँ. बार बार सरफेस क्लीनिंग, बाहर से जो थैली लाए उसको क्लीन करना, धो लेना, दूध की थैली, वो सब चीजें थोड़ा सा कम करना चालू, बिकॉज there is no way you can prevent and there is no way that you transmit COVID by surface transmission. So it is proven that it is this area, the nose, mouth, and maybe little eyes, from where you can get infected. So protect the head face neck area from the other person's respiratory droplets, and that is the only way. That is your immunity passport to protect you and your near and dear ones from COVID. बट ट्रीटमेंट की बात करें तो बच्चों को कुछ ट्रीटमेंट नहीं रहती. जैसा मैंने कहा कि थोड़े बड़े बच्चे रहते हैं, those who are about 8 to 10 years, and sometimes they have severe COVID. Or then there was a child who was diabetic and he had COVID, so we had to give something to him also. So sometimes some medicines are given like remdesivir, but by and large pediatric COVID अपने आप ही ठीक हो जाता है, उसको कोई दवा की जरूरत नहीं.
Thank you, sir. Since we are talking about medication, some of the doctors are prescribing some medications to our users to have it during COVID, right? So, are these medications prescribed by the doctors safe for breastfeeding moms?
Yeah, so क्या हो गया, जब these medicines came, there were no studies done for breastfeeding moms पे कभी किसी ने किया नहीं था. So initially it was all strict no. But then now it has been found that some of the medicines are what we call as protein bound. Very less amount gets secreted in milk. So let's talk about only two medicines, two or three. So favipiravir is one such medicine which is given at a very early stage to the affected patient so that it doesn't complicate. और ये दवा का फायदा सिर्फ पहले चंद दिनों में होता है कोविड का डायग्नोस होने के बाद. सो आज आपको कोविड चालू हो गया, मानो डिटेक्ट हो गया, सो आज ही दवा चालू करोगे तो फायदा थोड़ा है. बट इफ यू कंसिडर दैट 5, 6, 7, 8, 9 दिन के बाद तब तक वायरल रेप्लिकेशन बंद हो जाता है. सो डू नॉट गिव मेडिसिन लेटर ऑन. सो वन इज फेविपिराविर, सेकंड इज आइवरमेक्टिन विच इज गिवन. अगेन देयर आर नो स्टडीज, सो आई डू नॉट गिव. मैंने आज तक किसी को भी ये आइवरमेक्टिन दिया नहीं, बट दी जाती है. इट इज ऑल्सो ओके, सेफ in breastfeeding. And the third one is remdesivir. Remdesivir is an injectable. That means आपको थोड़ा CT severity score ज़्यादा है, probably आपको ऑक्सीजन रिक्वायरमेंट है, probably आप ICU में या हॉस्पिटल में एडमिट हो. Then in that cases, if the mother is really sick, then you need not breastfeed the baby. Otherwise, all these medicines, very less amount gets secreted in breast milk. Though per se they may set special precautions or contraindications बताएंगे, but then in early course, oral medications do not have much problem if you are breastfeeding the baby.
Thank you, sir. Okay, there is one more query here. My pediatrician told me that because of COVID, my baby's digestive system is affected. She is, and she's lactose intolerant. So she passes motion and gas immediately after breastfeeding, and she cries when she pees and has motions. It is very painful for her during urination. She cried a lot. There is no pink rashes near her anus. So, is there something to worry about, or is it normal in newborns to have painful urination?
Exactly. So
Yes.
इसको आप कोविड के साथ don't connect it with COVID. This baby is not affected because of COVID. ये सब हुआ है. So this is something which is kind of infection which is common in most of the pediatric patients. The diarrhea which happens in pediatric is usually a viral diarrhea. It is watery kind of diarrhea. It's a self-limiting kind of diarrhea. And there is something called as dysentery. There is blood and mucus both in the stool. So wherein we have to give antibiotics. But in most of the patients, we do not even ask to routine examination also, and we do not stop breast milk because these are all self-limiting conditions. Please do not stop breastfeeding. ब्रेस्ट फीडिंग बंद करने का एडवाइस देने के पहले 10 नहीं 100 बार सोचना चाहिए डॉक्टर को बिकॉज इट्स एक्सट्रीमली यानी किसी को बोलना सांस लेना बंद कर अगर बोलोगे तो यू विल से अरे डॉक्टर साहब इतना सीरियस क्यों हो गए बट इट इज दैट सीरियस एडवाइस डोंट कैजुअली जस्ट नहीं 2-4 दिन दूध बंद करो नेवर गिव दैट एडवाइस स्पेशली इन द फर्स्ट 6 months तो बिल्कुल ही नहीं and then this baby probably has some indigestion which is unrelated to COVID, will become all right in couple of times. Sometimes they need something called as lactobacillus. So these are probiotic kind of medicines. So which will make your baby's GI tract come back to normal. So don't worry about that.
Thank you, sir. Uh, Panpri is saying my husband has been close contact with uncle who got COVID positive later the same day. It's been 2 days. My husband is fine. Should he avoid touching my baby? Baby is 4.5 months of age. If yes, for how long? Baby was vaccinated yesterday and had fever in the midnight. Sumol was given afternoon today. Little heat is observed. No medicine is given. Is it related to COVID or vaccination?
Which vaccine was given?
Uh, Manpreet, can you put it on the chat which vaccine
Okay,
was
so
given?
no problem. Let me answer that. Whatever vaccine, even if we don't know. So this husband had come in contact with somebody who had COVID, but husband has no problem. So he is not yet infected, but he's a nice husband and is a very great father. So he wants to protect his child. But before that, protect your wife. So don't go near to your wife. That is more important rather than child because वो बेचारे को होना नहीं चाहिए. Very less chances of baby getting. So that is very important. But so 4 to 5 days is roughly the period in which if you have got infected, you will start developing symptoms. अगर आपको husband को वो 5-6 दिनों में कुछ भी नहीं हो रहा है, so he should just forget about it. But if he has slightest cold, fever, running nose, body pain, weakness, myalgia, he himself should get himself tested. So if he is asking me how long he should take care, it's about 5 days since the day of exposure.
Thank you, sir. So Chanchal, who was positive after her C-section, is asking, is there any chance I will know if my infant is having COVID?
There's no need. If your infant is fine, not showing any symptom, अगर उसको बुखार आता है, उसको सांस लेने में तकलीफ होती है, then you should go ahead into getting the baby tested. Why do you want to just assume or presume that whether my baby is? Don't go into that parallel track of thinking कि शायद इसको हुआ रहेगा. No, you are yourself had COVID. You have become all right. If your baby had symptoms, we would have tested this baby. If it is not so, it's okay. So even if the baby had infection, baby will develop antibodies. एक बात मैं बताना चाहता हूँ कि children, why there is a difference is because children have innate immunity which is very well trained. In fact, we give so many vaccines, so their immune system is trained. So it takes care of this COVID infection also. Second important reason is adults को जैसे diabetes, blood pressure, asthma, कैंसर, सो मेनी ओबेसिटी, ये सब चीज़ों से ना वैस्कुलर लाइनिंग का थोड़ा सा काम करना ठीक नहीं रहता है. सो देर इज अ चांस ऑफ गेटिंग कोविड इन्फेक्शन. एंड थर्ड वेरी इंपॉर्टेंट रीजन इज दैट कोविड के लिए जो रिसेप्टर्स लगते हैं रेस्पिरेटरी ट्रैक्ट के, दिस रिसेप्टर्स आर नॉट वेरी वेल डेवलप्ड इन पीडियाट्रिक एज ग्रुप. सो दैट्स वाई कोविड को उधर फुट रखने को, यू गेटिंग अ फुट होल्ड समवेयर एंड देन गेटिंग इन्फेक्टेड, उसको चांस ही नहीं मिलता है. सो दो ACE2 रिसेप्टर्स करके रिसेप्टर्स रहते हैं विच आर नॉट देयर इन वेरी वेल डेवलप्ड इन पीडियाट्रिक एज ग्रुप. सो इसके लिए बच्चों को कोविड के बारे में आप ज्यादा सोचो मत, बिकॉज बच्चों को ज्यादा इन्फेक्शन होगा ही नहीं. आप अपनी फिक्र करो और अपने बड़े बुजुर्गों की फिक्र करो. दैट्स वेरी इंपॉर्टेंट. बच्चे फॉर्चुनेटली दिस सेकेंड वेव some problem more than the first wave. First wave no कुछ नहीं. I had about 200 patients I had seen. Not even one got admitted. किसी को दवा की भी जरूरत नहीं. This I am talking about the break which was I think December Jan. We were good. So before that in September के पहले की बात कर रहा हूँ. But now if you ask me, I am seeing more number of patients. But still, fortunately, keeping fingers crossed, pediatric patients getting complications, I have not yet come across.
Thank you, sir. That definitely gives a lot of hope to the mothers because they've been more anxious about the babies. Sir, Shweta, a little off topic. Shweta is asking, my 3-month-old baby is having sneezing since birth. Can it be allergy or is it something serious?
3-month-old baby having sneezing since birth is not a very common manifestation. So usually babies don't sneeze from birth. So I think even if she's थोड़ा सा उनका हिस्ट्री में थोड़ी गड़बड़ हो रही है, it must be little later. But then whenever we call somebody of allergic rhinitis जिसको कहते हैं, जिसमें this kind of sneezing can start. So the important clue for this is if the patient's family का मतलब close contacts, that means mother and father. Is there a family history suggestive of allergic rhinitis in mother, in father, in elder shape, grandmother, grandfather, very close family members, then probably this baby can develop allergic symptom. But they are still not a feature in first 3 months of life. After that, you may say. But along with this, if the patient also has skin, यानी खुजली भी आती है और skin rashes भी आते हैं, urticaria, seborrheic dermatitis. So these are all skin manifestations of allergy. Nose is nasal manifestation of allergy. Asthma, wheezing is respiratory manifestation of allergy. Skin rash like urticaria is another skin manifestation of allergy. Food allergy, ये different types of allergies में से अगर एक दो चीजें हैं, then this is an allergic patient. Otherwise, I'm not sure because this is an extremely uncommon manifestation in first 3 months of life to have baby getting continuous sneezing.
Thank you, sir. Sir, Megha is asking, is it safe to hold a baby or play with the baby once the family member has tested negative? After testing negative also, is there any chance of infecting others?
Very, 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 very nice question. So suppose I have fever today, okay, and I immediately test myself today, it is fine and it has come negative, but my fever doesn't go, so there is a chance on third or fourth or second test I may still become positive. So fourth or fifth day को test किया तो वापस positive हो सकता है. So it is always better to stay away physically for at least 5 days. You should be symptom free. So 5 days आपको कोई भी बुखार नहीं आया, आपने बुखार उतरने की कोई दवा नहीं ली, and you were always negative when you tested before, then in all practical probabilities you are not harboring COVID infection. But then if you want to be extremely cautious and safe in protecting others from your so-called probable infection, then 10 days is the golden rule.
Thank you, sir. Moving on to the next question here. Does COVID affect the fetus in pregnant women?
Yeah, earlier what happened is there were some reports in Kandivli, one Shatabdi hospital, so they had published a report that some fetal affection was there. But now it has been shown that most probably nothing happens, even if the mother has COVID infection during pregnancy, there is no happening to the fetus. So fetal growth, if it is monitored well, and of course all of our babies have institutional deliveries, and they're monitored by trained gynecologist obstetrician. Time to time sonography is done, the tests are done, and we have yet to come across any such alarming discovery of patients getting malformed babies because of COVID. Touch wood, and I hope and I'm sure that probably it should not affect the fetus because the mother had COVID. But still, the time is too early. Maybe another year will go when we 100% can say that COVID, even if it occurs at any stage of pregnancy, nothing happens to the fetus. And as of now, the answer is little. Let's wait for some time.
Thank you, sir. So I'm going to ask a few questions related to day-to-day functioning with COVID. So here one question is Natasha is asking, can newborn who is positive be given to adults who are negative to take care?
I've already answered this question. That is newborn. If you are negative, everybody in the family are negative, then there's no problem. But even if one person is positive in the family, there is a possibility that that person through second or third contact can give it to newborn baby. So if
No, so the question is ulta here. If the newborn and mother are positive, so can
okay,
the family members who are negative take care of the newborn for some time?
newborn and mother are positive.
Yes, can the family members take care of the newborn for some
No,
time?
no, 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 no. Never, 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 never. Very good question. Never do that mistake. Many times this happens that mother is positive. They have two kids. One is 3 year old and one is suppose 6 months old baby or something like that. And they said कि बच्चे को हम दादी के नानी के घर में भेज देते हैं. वहां पे सब लोग ठीक ठाक है. अरे भाई, but by that time this baby could be infected, and is it possible that this baby can transmit this infection to the seniors at other house? So no other members, this baby, these children should be with mother only. So let them be in one room. So there are, as I said, pediatric patients do not have complications. In fact, chances of getting infected and having complications are so less. But please do not send them to somebody else or some others in the family. This is the problem which is happening. This is the most important question on in last 47 minutes which was asked to me, and very important point that please, even if your baby is negative, you are positive, please don't send these children to others in the with the seniors in the house, because there is a possibility this child can have infection. He may remain asymptomatic but can transfer the infection to others. Very important.
Thank you, sir. Sir, another question is if I'm taking care of the baby 24 hours inside the room, do I need to sleep with my mask on if I'm sleeping next to the baby?
Not at all, not at all. You can sleep without mask. So you are negative, right? Or you're positive? Mother is positive or negative?
Mother is positive.
Oh,
Both
then
mother and baby are positive.
yeah,
No,
then
like so basically, if the mother is positive, do I need to? She's isolating
I
herself,
told
and
you,
you
I
are
told
saying
you
don't give the
that
baby here.
you are allowed to breastfeed the baby, but still take chance care that why should it the respiratory secretions can very well give it to babies. So it is better to the cough etiquette should be followed by the mother, and if she's coming close proximity of baby, it is a good practice to follow the wearing mask. That's a very good thing. And then if she's away and then she's doing her own things at the other corner of the room, it's fine, but the moment she's in the close proximity of 6 feet with the baby, it's a good practice to wear a mask. Yes.
Then probably it would be a good idea to have a crib next to your bed so that you can also sleep in peace and baby can also sleep.
Perfect.
Yes. Uh, One second. So, my mom is COVID positive. When can she visit us? Do we need to repeat RT-PCR before allowing her to see my baby?
So no repeat RT-PCR once you're positive. It is considered after 10th day of infection, you do not transmit to others. To be on safer side, add 4 more days. 14th day after her first day of symptoms, or the last 3 days, if she was not taking any fever reducing medicines, she had no fever, she is most welcome to come your home. So 14 days is the time limit and no repeat of test.
Thank you, sir. So, Namrata is saying my brother had symptoms. Antigen was negative, but doctor said he is positive and medication started. Next, I found runny nose and fever, and doctor gave me antibiotics, vitamin C. My 4-month-old baby got fever and sneezing. Uh, and before that had orange white residue after her urination deposit in the vagina. Could it be due to COVID? My baby is strictly on breastfeeding, and my 5 years old daughter also has symptoms.
Oh, so that means his brother was infected. He gave it to his sister and then sister to her daughters. So it's a change. This is what happens. So that's why one has to be really careful. If you're symptomatic, stay away from your close family contacts if you love and care for them. This was totally avoidable. But now our question is the vaginal discharge, which is talking about a small baby. It's a known physiological thing that oranges discharge, which babies, many females secret. So it's normal, nothing happens, and it stops on its own. If it persists for more than 3 or 4 days or 5 days, then you must consult your doctor, and whether it says the discharge or whether there is blood. I'm more interested in that. That is one. And now your elder daughter, who's 5-year-old, is also positive. But fortunately, as I said, rest be assured that and in all probabilities, both these your 5-year-old and the younger babies won't have any problem. You take care of yourself, but at least stop transmission from you three. Should not give it to somebody else. So that stopping the spread is what is in our control, and that we must do.
Thank you, sir. I think we're almost running out of time, but there's a question not related to COVID. If there's time, she wanted you to take it up. My breast milk is quite sufficient for my 4-month-old baby, 4.5-month-old baby. His pee and poop count is normal. His weight is 6.2 kg and height is 63 centimeter. My pediatrician said strictly do breastfeeding until my baby completes 6 months. Elders at home are suggesting to start formula milk and solid foods as baby is showing frequent signs of hunger. Please advise.
Your baby is growing well, no problem. Whatever your pediatrician has told is a perfect advice. Exclusive breastfeeding for first 180 days of life, that is 6 months. And after 6 months, there is complementary feeding. That means giving other food which is complementing the breast milk, supplementing the breast milk. So it is not weaning is not the word used nowadays. So you don't wean off from breast milk. You continue breast milk, but add on something else so that your babies, because otherwise there will be nutritional compromise on the baby's health, because breast milk alone is not enough after 6 months. But please tell your seniors in the house, no, no, no. I am a good mother and I have been told by my pediatrician, and today I attended one more webinar, one talk, and where the doctor was so emphatical about giving only mother's milk for 6 months. And the moment my baby is 6 months, I'm going to start with complementary feeding. So please tell them, and that is the importance of growth chart. So once you have a growth chart, you can always track the baby's growth, how the baby's weight, how the baby's length, the head circumference, all the parameters can be shown. And that's a reassuring factor for others also to know that our baby is growing well. So you're a good mom. I'm happy for you. And keep feeding your baby till 6 months and till 2 years of age. But start complementary feeding only after the baby is 6 months of age.
Thank you, sir. This is one challenge I think most of our mothers are facing, trying to balance between what the pediatrician says and what the family says. So, yes, probably they have to stand firm in what they believe in. So, sir, there are a few repeat questions since they joined late. I'm really sorry. For 5 minutes, I'll just take them up. Urvi is saying, sorry, I could not attend
No
the
more,
whole
no more
webinar.
repeat questions.
Sir?
I said I'm tired now. 54 minutes I've been talking.
So sorry, sir. Just 2 more minutes I'll take. You can just brief them on the whole thing.
So what happened is I just came and
So
sat and I didn't take the glass of water. So that's the only thing. Otherwise, okay, fine. Couple of questions. Last rapid fire.
yes. Urvi is saying, my husband was tested positive for COVID 3 days back. What should I do? I do not have any symptoms yet. Just isolate.
So your husband was positive 3 days back. So last 3 days you were already with your husband. So in all probabilities you have already got the infection. This second wave, mind you, is spreading like fast. So even if you are with 1 hour with your husband who was positive, you can get it. It was not happening in the first wave. So this is something because of the double mutant virus which is spreading in Maharashtra. So now you keep your fingers crossed that you don't develop symptoms. If you have good immunity, the virus in your body will get killed. You will overcome the challenge, and maybe after a couple of months, when you do antibody tests, you know that you have good antibody levels, and probably this was COVID. If it is not, and if you have symptoms, then you must check yourself. But till then, next 5 days, at least you don't expose yourself to still more other people, so that tomorrow if you develop fever, then you say yesterday I was with my the grandparents or somebody else in the house. So let's not spread this. So now you be still protect yourself, stay away from your husband for now till next 3 4 days, and then assess as and when your symptoms develop. Either get yourself tested or then forget about it if you don't develop anything.
Thank you, sir. So, Harini is saying, is it possible that the baby can get COVID first and then the mother? Because most of the outsiders come in contact with the baby, and despite restricting them, they don't understand. So, how to handle this situation better?
If after 1 year, if your relatives are not understanding the seriousness of COVID, then God save them. So you very rightly said that it is possible that children get it, especially small babies cannot get it unless and until some adults have transmitted to them. So either you're somebody from the household or from neighborhood, anybody can give it. And now what happened is when the children were at home, initially children were considered again getting only from the adults at home. But now since last couple of months when the things had eased down, children started playing out. So the all kids, so 7, 8, 5, 6 year old, mixing with 10, 12, 13 year olds, and they were all bringing infection from their houses, giving it to each other. So that is also possible that without adults in the house getting affected, children can bring it. So right now, in fact, though I am a very strong proposer of and children should go out and play for 1 or 2 hours, next till 13th, 30th of April, let's all be indoor and let's not venture out and then stop the spread and getting virus into the house because the spread is really very fast. So do take care of all these things and avoid entry of COVID in your household.
So, related to what you just said, the next question Priyanka is asking, is it safe to take a 5-month-old for a walk in the park if the person holding the baby is wearing a mask? Also, baby keeps touching the mask. Is it okay? We don't have a baby in the stroller as baby does not sit yet.
So let me ask you, which park is open to take the baby? All the parks are still closed now everywhere. So, but still, if you want to take very early in the morning, it's fine going somewhere out or when there is, not people around. So in a crowded place, strictly avoided it. Let's all avoid crowded places. So that's very important. And if you have a private, garden in your society somewhere, you can go out. It's fine, but otherwise, and do not allow somebody. Otherwise, it's a common reaction. We in India immediately see a cute baby go and ole ole ole, and we start playing with the baby. Let's all stop that. Talking to strangers or anybody else in the elevator. Let's all stop that. So till 30th April, we should be extremely cautious, doubly cautious than what we used to tell in last March 2020. So they let this second wave, cool down. Let's all come victorious and then take the story further. Till then, we vaccinate, we wear masks, we keep distancing, and we keep using sanitizer. SMS should never be forgotten.
Thank you, sir. One important question I see here is, sir, if a child is COVID positive and if her monthly vaccination is around that time, can the vaccination be delayed for a while till the baby becomes negative, or can they go ahead with the vaccination?
No, you can very well give it after 14th day of the baby is fine. So same what we had rule we had applied for isolation, same is for vaccination. So after clinical recovery, I would say wait for about 2 weeks and then give the vaccine. whatever scheduled vaccine was there.
Thank you, sir. Kavita is asking if mother is having cough and cold, does she need to take the test and does she need to refrain from hugging and kissing the baby?
Only cough and cold is unlikely, but if she also has 99 fever, if she also has body pain, if she has myalgia, headache, and then some loose motions, then there is a possibility of COVID. So only cough and cold, unlikely. But if any of the one or two symptoms more, then she should be careful. But having said that, cough and cold are good enough to have suspicion even of a flu, which can also get transmitted. Influenza also transmits the same way. So cough etiquettes and taking care of the mask or coughing in the sleeves, washing your hands, all these things remain. Respiratory etiquette should never be forgotten now. It should become now our part of our DNA. That is the only way that I think India will become a better developed nation rather than succumb so many people succumbing to such infectious diseases. So it's a good learning lesson for all of us. COVID has taught so many things.
Thank you so much, sir. I think there are a lot of queries. You can do one thing after the session. You can go on iMumz YouTube channel, and we will unlist this video there, so you can watch it there. Sir has answered almost about everything related to COVID, every possible questions we've tried to cover. So, closing the session here, I'm really sorry if I could not take in your questions, but if it is important, do feel free to reach out to us and we will get it answered by our experts. And, sir, thank you so much for doing this session with us. I know I changed the topic last minute, but you were so accommodating. So, thank you very much for answering the questions. Everybody is thanking you on the chat for patiently answering every small query. So
It's a
thanks a lot,
pleasure.
sir.
It's a pleasure talking to and interacting. Unfortunately, I could not see the faces of beautiful mothers and the babies. I would have loved to because a direct interaction is much better. But then you were a wonderful face to have representing all these moms. But then let me again tell you, let's be very serious. Let's be all very cautious and take care of ourselves as well as not kids. Though I'm a pediatrician, I will not say kids because I'm sure kids are doing good. But the elders in our family, vaccinate each and everybody more than 45 years of age. Do not go for such outings, social gatherings till 30th of April. Humble plea to each one of you. And do not forget SMS, the sanitizer, the mask, and the social distancing. These are the only ways that we have to protect ourselves and come out victorious. So these are the days of just holding on, and then probably we should all be by another couple of months, and everything should be very good. So thank you very much, and I really enjoyed the session.
Thank you, sir. And everybody, have a great evening. I would like to tell you that we have a session planned for all of you on responsive parenting on Sunday. So do not miss the session. You will see the banner on the app, and we hope it will add a lot of value to your parenting journey. And we will see you in the upcoming sessions. Thank you, everyone, and have a great evening.
Thank you. Bye.